to Cleveland Conversations. I am Angela Gartner, your host today, and I'm here with Katie Jenkins, Executive Director of NAMI of Greater Cleveland. Welcome, Katie. Thank you for coming today.
Thank you for having me, Angela.
Well, a lot of people are probably familiar with NAMI, but I wanted to kind of start and wonder some of the things that you guys have that maybe people don't know.
Yeah, absolutely. So I'll start with like a little overview. NAMI stands for National Alliance on Mental Illness, and we are part of a network of over 600 different NAMI organizations. We have a national organization that's located in Virginia, a state organization that's in Columbus, and then we are one of several in the region that is county-based. And our role in the Alliance is to provide services directly to the communities that we serve. And so our mission is to improve the lives of those who are affected by mental health conditions. And it's important to say affected by, because mental health doesn't just affect the person who has the condition, it also affects their family members and their loved ones. And so we provide education services, community education, support groups, as well as several other psychoeducation. We work with the police departments to do crisis intervention trainings. You name it, we probably do it, or some version of it. And we do it for all of Cuyahoga County. So anybody who lives or works in Cuyahoga County is able to utilize our services.
And the reason we're here today is really to talk about mental health in the community. So with your office, what kind of trends are you seeing within the community right now?
So I think there's no way to talk about mental health trends right now without talking about the pandemic and COVID. We saw a large drop in individuals who were attending our services initially. And we're now seeing our numbers go back and surpass pre-pandemic numbers. And what really was difficult during the pandemic was people being in one place together with their loved one who had that mental health condition, as well as, the pandemic increased the number of individuals who reported mental health conditions. But what we're seeing a lot of is a lot more youth, parents struggling with youth that are struggling with anxiety, depression. We're also seeing an increase in just family members in general seeking help, because when their loved one's mental health is exacerbated, then they're asking for more support to be able to process through the different situations that they're going through.
Well, and you talk about that and about the youth, and why do you think that there is a rise in anxiety and depression right now? And we talk about especially after post-pandemic, but what is keeping that going, you think?
So prior to the pandemic, national numbers said that 1 out of 5 individuals had a mental health condition. Currently, in the state of Ohio, it is solidly 1 out of 4. So 25% of individuals who live in the state of Ohio have reported a mental health condition of some sort. In terms of our youth, I can speak from experience. I have a 11-year-old son who at the time was in 2nd grade. Yes. And he completely lost connection with his friends. He was entirely isolated from family, and it was terrifying. During the time of the pandemic, we have to remember that we also had George Floyd, we had Capitol insurrection, and if you think about, from a child's perspective, what they're seeing on the news, if they have access to social media, what they're seeing on social media, and unfortunately, those high-level crisis-feeling situations have not stopped. We continue to see them through Ukraine and everything that's happening over there. So kids are in a crisis state. They're being exposed to trauma. Additionally, if they have a family member who has severe mental health or addiction, they were locked in that house with that person during that
Right.
time. We talk a lot about during the pandemic when everybody was sent home, many kids lost that lifeline of security and stability that they had in school, as well as food. We talk about 64 hours of hunger and the time from when they leave the school to the time they return on Monday, being able to eat during that time. A lot of schools instituted providing additional food packages to kids during the pandemic. It was a lot. There was a lot happening, and it continues to happen, unfortunately.
Well, how is mental health and these kind of anxieties and depressions are impacting schools and even the workplace right now?
I think we're seeing a trend, thankfully, where workplaces are becoming more understanding and more affirming of people's mental health conditions. We went from a society where employers said, no way, you can't work from home. It's just not possible. We can't do it. And in a week, we were all working from home. And a lot of companies saw the benefit to their employees' productivity and their employees' retention. And so they've stuck with that hybrid or remote work model because they see the return on that investment. In terms of individuals who are still having to go to work or maybe don't have that supportive environment, absenteeism is a huge factor for them. Decreased productivity is a huge factor, as well as just general retention issues. When people are unhappy in their lives, work very rarely is the place they find joy. And so they're not going to work for that boost of serotonin and dopamine. They're going there to meet their life's needs. And if work isn't helpful and supportive, they're not going to stay there.
Well, and there was a recently talked about, chronic absenteeism with schools as well. So that is becoming an issue. Can you talk a little bit about that?
So there's a lot of factors at play with that too. There's no simple silver bullet for why things like this are happening. We have, thankfully, we're on the upswing for employment, but there was a period of time where parents that were in one-car households may not have been able to transport the kids to school. There was a period of time where there's fear about taking the kids to school. I know initially, unfortunately, if your child had sniffles, nobody knew what it looked like. Nobody really knew. They were like, what are the symptoms and how do you know? And it's like literally everything. If you sneeze, if your eyes water, if you vomit, all those things, yep, that could happen, and that's COVID. And we completely forgot about all of the other normal illnesses that we've always had. And so a lot of kids were missing school because they were waking up with runny eyes and sniffles, and rather than saying, oh, that's allergies because it's March and we live in Ohio, there was that fear that it was COVID, and they didn't want to send them to school to expose other kids to that.
Well, when we talk about depression and anxiety, can we talk about the ages? So, we talk about youth, but are you seeing it at a different age as far as in the adults are being a little bit more depressed, or is it across the board?
It's across the board. I think this was the first time in American history where everybody had the same experience. We've had incidents throughout the country, we've had things affect everybody in some way, but everybody had the same experience with this. And that isolation, that constant fear definitely increased people's attunement to their anxiety and their depression. And for some people, that lifted after some time when things felt a little bit more secure and a little bit safer. But for others, that is something that's going to stay with them.
Well, and are people getting help more, or is there still a stigma about mental health?
So I actually was on the way here, I was looking up some articles, and one of the ones that I found that I had not seen before was that there was between 2013 and 2019 a 383% increase
Wow.
in need for services. And as many are aware, the workforce for mental health is just not there right now. And so the need is there. Lots of people are trying to reach out and get services. The availability is not always there. The length of time to get services is not always there. And even more so, if you're somebody who struggles with acknowledging that you need help, if you make that first phone call and that phone call isn't responded to with the next solution, you oftentimes don't follow through. So, if I need help and I can't get in for 6 months, what is the point of making that appointment for that help? Because it's not, I need help now, not in 6 months.
And that person might fall through the cracks. How is like organizations like NAMI, helping that?
So we thankfully partner with a lot of the community behavioral health agencies. And one of the gaps that we get to fill is, if somebody is trying to get into individual counseling or something like that, we offer that support group option as kind of a stopgap measure before they can get into seeing a therapist. And the support group services are all done through a peer lens. So the people who are doing that support group have the lived experience of either being somebody with a mental health condition who's in recovery or being a family member or loved one of someone. And so that connection, being able to start sorting through problems, being able to recognize that you're not the only one who's going through it, is a huge support. And so our goal is to get people from that first phone call to whenever that appointment happens by engaging them and providing them the support they need.
Is there common mental health disorders that you're seeing, like conditions like right now, you think?
Depression and anxiety are the big ones. I feel like they're the words of the moment, and that's simply because we all went through something that was very isolating. I keep saying isolating. Yeah, we all felt really alone, really terrified, and things like, we ran out of toilet paper in the stores, and it felt like the world was ending. And so a lot of people, that was very real for them.
Yeah, for sure. That was real for me too. What about the symptoms? Like, as far as when someone's struggling with anxiety and depression, especially someone outside looking in, what are some of the symptoms that you might see somebody being in that condition?
So with anxiety, you can see, and actually with depression also, you can see the individual becoming more withdrawn, more avoidant of situations. Increased irritability is a factor that you should look for, also for both. With depression, they stop engaging and doing the things that would normally bring them joy. If you see somebody who is going home immediately after work and not hanging out with their friends or not engaging with their significant other, then that's a huge red flag. Additionally, if somebody is always tired, that can be a factor in depression because your system is just done. With anxiety, also nervous tics and habits are a sign to look out for. I actually have been diagnosed with depression and anxiety since I was 19, and I can tell when my anxiety is really bad because I tap my fingers, and I will not even do it with, I won't even think about it, and I'll be doing it, and suddenly I'm like, oh, okay, I have to take a breath and relax my shoulders and just be present. So.
Well, and I think a lot of people, who may think that they don't have anxiety and depression or they can handle it, can't. So how can you speak on those as far as in helping those people kind of get the resources they need?
So there are a lot of people who have anxiety and depression, and they can manage it without interventions, without medications and things like that. I always recommend to people that if you feel like you are experiencing mental health symptoms, your very first and best stop is your general practitioner. So your family doctor, your primary doctor, whatever you want to call it, because that person can very easily help assess you for those things and can start you down the path of receiving support. They are able to prescribe most common medications. If you don't want to go the medication route, they're able to give you referrals to services as well as connect you to resources in the community. For those individuals who can't manage those symptoms, so mental health is a problem, anxiety, depression, we all go through phases of that. Grief is a phase of depression. We all have nervousness. Yeah. But when it becomes something that disrupts your normal life, that is when you need to seek the next level of care. And so I always say start with your primary care physician, because they're easy to get into, and you typically have a relationship and they know you well enough to be able to go, you know what, that's not normal. Let's see what we can do to help.
When talking about a little bit about the stigma, because if you have you're experiencing a mental health crisis, you might try to hide it, or maybe there's some type of barrier against that. Can you talk about a little bit about the barriers to mental health, of getting that help that you might need?
So we talked about the very first one, which is the availability of services. The other things that are barriers very often are cultural. We see a large drop in engagement in services in our Black and Brown communities. Mistrust of systems, mistrust of governments, things like that all contribute to people not wanting to engage, as well as it just not being normalized in their communities that they're in. Men very much have been raised for a very long time with the standard that men don't cry, men have to be strong. And that's not the case, because men do cry. They have tear ducts just like the rest of us. And so getting through those things and accepting that everybody is the same. Everybody has struggles, and that the people who matter are going to accept you regardless of those struggles. And I think it's hard to imagine when you're in that dark place that it's going to be okay and that everybody is going to love you no matter what.
Well, there are some, effects or for depression, anxiety, and one that it could lead to something like suicide. Yeah. So can we talk a little bit about that, about what are the warning signs that it's getting to that might be getting to that point, and there might not be any, right?
So I think a lot of people who are survivors of individuals who have completed suicide will tell you that no amount of reflection is going to give you the answers that you want. Sometimes people are giving us very direct signs, and sometimes people just complete suicide with absolutely no communication previously or indication that it's a problem. A lot of things that you can start to look for is people who are closing loops, saying their apologies, saying their thank yous, giving away things that are important to them, things that have value to them, putting their affairs in order, whether it's paying off bills or creating wills and living advance directives and things like that. And I want to make sure I say these things on their own are not necessarily things that you should be watching for if you're concerned about somebody, but together they are definitely warning signs. As well as, we talked about with depression, no longer doing the activities that they enjoy. So if they seem to be withdrawing, if they seem to be avoidant, those are also very important things to watch for.
Well, and it doesn't just happen in adulthood. Mm-hmm. It also happens in youth. Can you talk about what that looks like and what parents can do to help their son or daughter get through something like that?
Absolutely. So in a previous life, I worked in an emergency department as a crisis clinician. and the number of young children that came in was heartbreaking. I've seen a 6-year-old come in and tell me that they did not want to live anymore, and they had made attempts. And so I think it's really important. A lot of people will say, oh, they're 6. What do they have to be sad about? Why would they want to do this? There's no explanation for why they feel that way. But as a youth, your life is very limited. So for me, something that happens awful today, I know is very possibly going to be gone in a week. And that week is very minimal in the history of my life. But for kids, teenagers, adolescents, that week feels very much like everything. And so having that perspective is very difficult for them to have. And getting them to understand that taking your own life is permanent. It's not something that can be undone. And so, yeah, it's absolutely awful, especially as a mother, to see parents going through that with their children. I think the most important thing that I can tell to parents is if your young one is expressing anything that looks or sounds like suicidal intent, take them seriously. Don't make a big deal out of it, but also don't dismiss it as though they don't know what they're talking about or they can't possibly feel that way. Because every single thing our kids say to us is information that we need to have, and it very easily could be a cry for help.
Well, and one of the final things I wanted to talk to you about was stress. There's a lot of stress. I feel stressed a lot of times, but can you talk a little bit about how stress relates to mental health, and especially there's so many world things going on, continued world things, just not from the pandemic, but now we're feeling a little bit more, there's a lot more stressful world events going on. So talk a little bit about that and how people can kind of help manage those things.
So stress has a very significant effect on our physical health. For anybody who's gone through a long period of stress and then once it's passed, gotten sick immediately after, that's because your immune system has been getting you through that really hard time, and now it can give up. And so it's important to manage stress in a way that feels almost bite-sized, to not be in a state of ongoing, consistent amounts of stress. And so doing things like breathing exercises, doing things like walks in nature, pausing in between activities, giving yourself space. A lot of people talk about self-care. I hate the term self-care. I really do, because when people say self-care, what do you think of when I say self-care?
Just taking care of myself.
Okay. A lot of people will say pedicures, manicures, a massage, and it's like a pedicure is only going to get you through so many days.
Yeah.
I like to think of it as self-preservation, and so it's moments that you can build into your day that can make your life easier. So I know a lot of people who sit in their garage for 5 minutes when they get home because they need that moment before they go into whatever their household is happening. Self-preservation looks like, right now we all have Zoom meetings back to back, right? There's no break. Before we traveled, we had those moments in our cars or even walking to another space. But with Zoom, it's easy to do meetings one right after the other. So self-preservation is setting your calendar up so that you have 5 to 15 minutes between meetings regardless. Like no questions about it. This is how I'm going to operate my day. Water, drinking lots of water, eating well as physical activity, and just fresh air. Fresh air is a miracle when it comes to stress levels.
Do you believe in like the breathing techniques?
I do. So those are a lot of grounding exercises, and I know some individuals who are very uncomfortable with the breathing techniques, whether they feel like it feels silly. A lot of times I think it's because we're in our heads too much and we're too focused on like what somebody else around us might think, or maybe we don't want to be in our heads when we're doing that activity. But one of my favorite exercises is the 5 senses exercise, and it's really just sitting in your space, and it can be done very quickly and very silently, which is why I love it, because if you're like freaking out inside, you just sit there and you identify mentally 5 things you see, 4 things you hear, 3 things you are touching, 2 things that you can smell, and 1 thing you can taste. And so you run through that list very quickly, and at the end of the list, you are very aware of the things that are around you, and you're no longer in your head, you're present and accounted for that moment.
No, that's great. And I think people need more self-care tips not self-care.
Self-preservation.
Self-preservation. Sorry about that. Self-preservation. So, but the one other self-preservation might be volunteering, right?
Yes.
So, and doing that kind of thing. And I know NAMI has a lot of good opportunities to get involved, and really it might be a good, again, self-preservation thing that someone can do.
I'm going to trademark that phrase because I've been on like a tour of just yelling out, don't say self-care. So yes, finding value, giving back to your community, even sharing your own story can be very cathartic for people. And so we are very blessed to have over 130 amazing volunteers in our organization. And really a lot of our programs are run by volunteers. We are always looking for more volunteers. And volunteering with us could be doing an ongoing support group, doing a class, or just showing up and telling your story at an event. We have events that we do, a walk, and our walk is in September this year, NAMI walks at Edgewater Park, as well as some other smaller events where they can just come and help give out name tags, whatever is going to be easy for them.
Well, I really want to say thank you for joining us today. You know, I really appreciate all your feedback, and I think it was very valuable to everyone. I do want to mention that if anyone, if you or anyone you know is struggling with a mental health crisis, please contact the 988, the Suicide and Crisis Lifeline, or the local, which is 216-623-6888. Also, for NAMI, the helpline is 216-875-0776, or you can text the crisis text line at 741741. Well, we hope you enjoyed this conversation today at Cleveland Conversations, and we will see you next time.